So, ladies and gentlemen, welcome to the town hall. And it's a pleasure to have you all here today. And I'm going to co-moderate this session with Dr. Brian Tegomo. But I think while waiting on the other moderators to join us, it's really a pleasure that today we do have a distinguished guest with us who is the director of the regional hospital in Bamenda. And he has honored us with his presence here for us to really get to know how we can. Today is the initial, let me start by telling everyone happy National Day. Cameroon is celebrating its National Day today. And we all pray for peace, we pray for unity, and we pray for progress. So that is really one of the goals behind this. I know a lot of you would love to be back home celebrating with your loved ones, including the director. I think there are a lot of parties going on right now in the Northwest region, including the big ones that he had to be there, maybe with the governors and the others, dignities, but he has sacrificed his time to be with us, and we do appreciate the fact that he's going to be with us here today. So it's really an honor having him here, and it would be our pleasure to listen to him how the regional hospital in Bamenda has succeeded to continue to run its activities despite being in a conflict zone, we want to call it that way, where we know that there are a lot of constraints that happen, especially in order to provide appropriate care. And despite this period of time, I know you have won Best Hospital in Cameroon multiple times, which is amazing to see that despite all of these difficulties, you've been able to do a wonderful job. So I would like to just pass the mic over to my co-moderator, Brian, if Brian has anything to say before we go ahead and introduce the speaker.
Yeah, no, thanks a lot, Mono, and thanks a lot also, Dr. Dennis Sami, for inviting, for accepting the invitation to speak today. This subject of addressing, providing healthcare in a conflict zone, it's something that I think we don't talk a lot about, Dr. Mono. It's the need and the challenges that surrounds providing healthcare in very conflict zones, and I think Dr. Dennis Sami has had that experience with, has been able to demonstrate this with a lot of success, and this is not necessarily only specific.
Yeah, so we are kind of, I think Brian also traveled, so he's joining us from Chicago, which is a bit, his internet is going to get back to us. So as I want to say, Bamenda is, to me, that was my first posting, the Northwest region, when I left medical school. And after getting all the feedback, so it means there is savoir-être and savoir-faire. So I think without wasting more time, just to introduce to you the person who is here with us today, Dr. Same, he has more than 20 years of experience in the field of healthcare management. After graduating from QS, he has more years in managing our hospitals back home. And it's really a pleasure to have him here. As I said, Bamenda was my first posting when I left as a junior doctor. And I've heard only good things. From everywhere you have been posted, I've heard only good things, meaning that you are a leader and not just being a boss. You lead the people towards something which is more than what we can actually discuss here today. So Brian, over to you, please, before I introduce the person we're talking. I know your lines actually, and Dr. Kate also joined us, who is also part of the moderating team.
Yes, sir. Thank you. Sorry for joining slightly late, about 7 minutes late.
Yeah, Dr. Monot, my apologies. I'm not currently home. I'm in a different state region, and the internet connectivity where I am might not be the best. So yeah, I'm really very thrilled. Looking forward to hearing insights from Dr. Dennis. Is very, very crucial. The World Health Organization has highlighted how critical these kinds of conversations is, and I think having the opportunity to learn from Dr. Dennis Same, who has had the experience of working through this for several years. As we know, Cameroon has gone through a lot in the last several years, and how to provide healthcare, how to overcome these kinds of challenges, not only in medicine, but also how do you public health, how do you ensure effective vaccine coverage when there is, disruptions in care? How do you ensure appropriate, care for all kinds of, diseases across the regions? And we've learned throughout the COVID-19 pandemic that disease, really, there are no boundaries really between regions. So all those things, I think those are some of the key things I would like to learn a lot today from Dr. Dennis, how he has been able to successfully do this in the last 2 years. And I hope that the lessons we learned from our conversations today would be applicable to many other African countries that need this knowledge, that need this, to hear about these success stories and everything. So thanks a lot, Dr. Mono. I'm really looking forward to this conversation.
Yeah, thank you. So without wasting much time, I would just do a brief, try to be as just as possible to Dr. Same. He has more than 25 years working experience in Cameroon and in the managerial post. And Dr. Dennis has worked as director of a district hospital in Batibo, which is one of the regions too that my mom is from that region, so I know that hospital very well. And he later on worked for 10 years in Abombang in the East region, where he was director of the district hospital there. And later on, he was director of the district hospital in Limbe. It's important to note that the people of Limbe are missing him so much that each time I talk to any of those who have been working there, they keep telling me, why don't you send our director back? I don't know who is going to do that, the minister, but you left a mark in Limbe, which is extraordinary. And he's been the director of the regional hospital in Bamenda now for the past 3 years counting. And while being there for 3 years, there have been multiple changes, and went there during the period where we had a lot of crisis going on in the Northwest and the Southwest region. And without forgetting that during this time, he had a lot of collaborations that he's going to tell us about. I did participate in one of those collaborations, and I felt very honored to have met someone who really meant well for his people during the COVID pandemic. I and Dr. Brunhilda Santos were able to collaborate with the Northwest region through your help and try to provide care to our people. Also, he has an MBA from a prestigious university. That's why he's a good manager, and also has done hospital management. And he has a lot of interest in different public health programs, including vaccination, including HIV management, TB program, malaria. So just to name a few. And please, I would like you all to welcome Dr. Dennis Same to this platform, the Cameroon Town Hall for Healthcare Professionals. We meet every fortnight to talk about healthcare issues in Cameroon, discuss them, be as friendly to each other, but try as much as possible to get our questions answered in a gentlemanly manner, and be able to evoke topics that and create collaborations also. Because after this, I would really want you all, not only to the Northwest Regional Hospital, all the hospitals in Cameroon, the different elites in the diaspora, see how you can get involved. I think Dr. Same is going to tell us a little bit about how others in the diaspora are getting involved in healthcare back home. So if you're here and you're thinking about collaborating, this is where we can start. So I love talking a lot, but I would have to stop, mute my mic, and hand over to Dr. Same. Please, you have the mic.
Thank you very much, moderators. My dear friend, Dr. Foma, Dr. Brian, and Dr. Kate, who are really co-moderating this session for our town hall this evening. And indeed, as I'm preparing to share my screen, I would like to really share with you that in Limbe, just to correct, I was at the regional hospital. So that is when I started managing the regional hospital. I think this was in Limbe, where I worked for 4 years before coming not so to Bamenda. So I hope you can hear me 5 on 5.
Yes, we can hear you perfectly.
Yes, we can.
Thank you very much. So indeed, this 20th May 2023, when we were just from, actually celebrations are still going on as we celebrate the 51st National Day under the theme, Defense Forces and Cameroonian People in Harmony to Safeguard Peace and National Unity, a bedrock of a strong and prosperous Cameroon. Yes, we are talking about really, providing care, not so in a crisis zone. It has not been easy. Going through queues, all the 7 years in queues, we never learned of that. And all this we had to learn on the field. And so I'm going to actually present this, the regional hospital Bamenda and all the activities we've been carrying out. I also share some achievements we've had and also our challenges. I know there will be a lot of pictures so that in less than 1 hour, I think I'll be through. So thank you. That said, I think we'll go ahead. And yes, this is just a plan of presentation. I think I will just go straight. And just to say, the regional hospital Bamenda actually went functional on the 5th of April, 56. I know 72, when they were creating provinces, it was called the provincial hospital. The provinces were changed in 2009 to regional hospitals, so they started calling it the regional hospital. Actually, it's the reference hospital in the Northwest region and also a teaching hospital. The regional hospital center that they were building in Quen actually is still not finished. So this would have been actually one of the teaching hospitals. And meaning that we cover a population of more than 2 million, and it has a bed capacity of 400. There are actually 31 buildings in the hospital and divided into many sectors. You have the administrative block. I think I will not belabor that. I will just go ahead to see. So now this is our regional hospital. It's actually a small village. If you see me taking all around, you see, if you see roundabout on the extreme left corner, you're coming, this is the road going to Ntarikon, those who know Bamenda, and this is actually, this is the other road that is not so going to Mbengwi. This is the Mbengwi road. So this is the main entrance, the main gate of the hospital. And those who know here, the maternity gate. This is the hemodialysis center, our outpatient department, and the Northwest Regional Fund for Health Promotion, infectious unit, and the mortuary is far behind here. And here you'll find I'm presently in the nurses' quarter. That is the director's residence is there. So the house is here for nurses, for theater staffs, and for some emergency staff. So we prioritize these houses for those who actually can be called when there's any emergency. And so this is that main entrance of the hospital. Now coming to the staff, the human resource in the hospital, I will share here. There are 519 staff. Here you have state employed staff, 156, and locally employed and some partners, there are 363. And so this gives a total of this 519. And I'll say these partners, we are talking about the Regional Technical Group for HIV, the CBC that are very much with us doing, and then the idea also on HIV, there are about 101 of them, all in the HIV/AIDS program. So, and of course, there are 50 doctors, and in internal medicine, I think we have 7 surgeons, we have 11, and of course, general surgeons 3 and 2 neurosurgeons, but 1 is very much present, Dr. Nchufo, 3 orthopedic surgeons, and just permit me mention those ones, and 2 pediatricians, 2 gynecologists, and 2 radiologists. And I will go straight to other issues. Now, coming to some indicators in the hospital. Yeah, I will just those diagrams. Yes, this is how actually since 2016 to 2022, you can see how new consultations have been going on. Yeah, okay. New consultations, let me just minimize this other thing. Yes, you find that we had the peak in 2018, and with this crisis, you know, new consultations have been decreasing until 2020, when we started having a regain of activities again, with the over 6 years of this conflict in the Northwest and the Southwest. Now, when we come to this other indicator, I can't read, admissions in the hospital, you can see that the admissions were actually reducing until 2012, when we could have this number. And deliveries, yeah, you can find decrease from 2016, the gradual decrease. You know, when there are conflicts, there's a lot of movements, people have been moving out. And since 2020, again, activities of delivery have actually been increasing a little bit. Yeah, and of course, we come down again to, yeah, this is, let me see. How can I minimize this? Because I can't see can't see the heading. Yeah, I actually wanted, I know, yes, this is just because I can't see my headings. That is why I'm telling this guy, what can I do to bring this down? Can't click, this is a pointer. Yeah, let me just go ahead.
I can also help share.
Yes, help me with the headings, you know.
Yes, I can help share from here and see if I share is going to help. If I help share your slides, is that okay?
Yeah, it's just
let's see
I'm saying it, I can't read the headings of my.
Let's see if I share them, then you'll be able to see your slides better.
Better, yeah, I think so. Some parts of it are cut, actually.
Because we can see your slides very well. So
very well. Oh, yeah.
Yes. So can you see it better?
Just to drop a little bit, there is a bar up there, which is actually blocking the headings. I know.
Can you see it on your screen now?
No, it's not the best.
Okay, I think it may be a problem with.
Let me just go ahead. I'm sure the slide. Can I bring it down?
Okay, let me stop sharing so you can share it.
Oh.
Okay.
Okay, thank you. I've gotten it. It's all right. I'm happy have my IT guy by me. So this were actually we're talking about deliveries. So I think everything is okay now. Yeah, good. Yep. Thank you. Sorry for that delay. Blood transfusion. Blood transfusion, I think, yeah, you can see that the hospital is actually a hub because we actually share blood to other health facilities. So it has not really been easy. You find that the request could be close to 5,000, but we are able to satisfy just about maybe half or three quarters, you see, but it has been fairly stable. We really thank those who have been coming to assist, to donate. Major surgeries. Yeah, minor surgeries, they actually decreased until 2019. And then since 2020, I think this minor surgeries, which is mostly at the emergency, they have been increasing. And major surgeries now too, yeah, we had the peak in the year 2017, and then it started dropping again. And then we've had some regain of activities, especially now we have 11 surgeons. Yeah, laparoscopic surgery. I think this is what we started in 2019. I think when I came with just within ups and gowns. So we could do laparoscopic surgery in ups and gowns, and then that is how it has been increasing. And this year, you know, with the coming of urologists, so we have that they're also doing this laparoscopic surgery in urology. Now, coming to COVID, actually, it's really good to know that indeed there has been this COVID crisis has really actually affected the hospital a lot. And hoping that just the cases that were screened of 16,500. And of course, positive cases of 2,000 up till the 25th of April, because you can see that we are still having some cases. And actually, presently, we have admitted in the hospital, and about 7 are taking treatment on home confinement. So we are not totally over. And these hospitalized cases, I think this one, the total deaths up till the 25th of April, we had since the onset in March, when we had the 0 case on the 20th of March, the case 264, and vaccination. The number of doses, we've given over 8,500 doses of all these vaccines, and to show that we've actually had about 5 waves. And to go to other indicators, yes, when I talk about active files here, those are the HIV. At present, I think the end of December 2022, the active files were more than 5,200. At present, we have about 5,300, amongst whom more than 450 are children. And TB, yes, last 2022, we had 130, I think, positive cases of TB. Yes, malaria has actually been gradually going down, and we are very happy with all the interventions from the Minister of Public Health. You find the cases better from 2021, last year, it increased a little bit to more than 3,414 malaria cases. Neonatal death, children who die is before 28 days of life. I think that has been a challenge that actually increasing. You see why we really need more pediatricians in the hospital, and we're happy that at least for those end of 2022, we had these 2 pediatricians, Dr. Kate and Dr. Fomenki, who are there. And maternal death is a concern. This is a very dirty indicator for the entire country. And of course, you know, more than, we've had actually 9 deaths last year. And with the Minister of Public Health, we do a lot of auditing. All maternal deaths must be audited so that we actually see what are the ways to preventing it. And to say we had, these are the 9 maternal deaths, and then we've had, hello? Yeah, thank you. And perinatal death, actually 69, those died either perinatal up to 7 days of life. And we have had 8 maternal and perinatal death review. And just to share with you what were some of the causes, because it's always important, because everybody to educate. The first case was a referred case from Bingo and ex-Quen, who came in an unconscious state, and actually the cause of death was epileptic crisis. That was the this really this mother. And the second case was a case that was referred from St. Blaise for better management of labor on a previous card uterus. And she died actually from a hypovolemic shock. The third case was a referred case from Tambak Integrated Health Center here in Mancon for management of pregnancy extracted just died after spinal anesthesia. So I think she had a shock after spinal anesthesia. And of course, the surgeons, the gynecologists had to do rapidly, and we actually gained the 2 twins, but we lost this woman. The fourth case was a referred case from BBH.
Yeah, so I think we're having a little bit difficulty with our Dr. Dennis' network while we wait for him to rejoin us. So I see, Brian, what is your thought so far while we're waiting for Dr. Dennis? I know he's in Bamenda, and as we said, joining us at times can be difficult. Network may not be very reliable, so, but he's going to join us very soon. I can see that a lot of the indexes that we use in order to measure for the effect of healthcare on the population were really affected by this crisis.
Absolutely.
So, Brian and Dr. Kate, any?
Yeah, the numbers were kind of staggering. I was looking particularly during the peak of the Anglophone crisis and how they had more and more patients. I was looking through the inpatients consults they received, the deliveries, the number of transfusions they had, and the vaccination coverage as well was quite impressive. It's instead reduced in the last few years. So I kind of have been staggered by those, by the activities that really continue to flourish throughout the crisis. So I think kind of brings to mind quite a few questions, how in terms of leadership, how he was able to leverage this during a very difficult time in the Northwest region at the time, and how he was able to keep these numbers going. I think it's been quite impressive. So I'm just looking forward to the end of the presentation.
Yes, you can continue and share your presentation, just that the network was a bit, maybe turning off your video may help.
Thank you, Dr. Brian.
Yeah, so turning off your video may help and increase the bandwidth.
Yeah. Thank you, moderator, Dr. Brian. Sorry, maybe I am back. Thank you.
We're getting you.
Yes.
So we're just having some difficulties maybe with the bandwidth and sharing from the Northwest region from Bamenda. We hope Dr. Dennis can rejoin us with this amazing discussion we're having. So we're looking forward to continue the discussion. So Dr. Jean-Claude Kate, what's your impression so far?
Yeah, great. I think so far it's important to see how the regional hospital in Bamenda is faring throughout the crisis, and
thank you.
of course,
my apologies indeed. My apologies for.
No, we do understand, please. So Dr. Brian and Jean-Claude just finished, then we'll get over back to Dr. Dennis.
Okay.
Presentation.
Okay, I was about to let him continue. So, but I think I really just look forward to the end, and probably to discuss some other topics. But I think it's interesting to see that towards the end of 2020, 2021, for most of the indicators he's sharing, and 2022, there seems to be an upward peak. Probably we would get into the discussions to try and find out what's happening. Of course, we know that most of the things linked around the conflict are still ongoing. Probably some of them have battered down in the main Bamenda, city center, and what's happening in other parts of the region, with people leaving from the other divisions coming into the big Mankong, where probably we'll get into the discussion to see how all of that has affected or has helped or affected those indicators.
Yeah, thank you. So let's give Dr. Dennis the privilege to continue. We're having good numbers. Turnout is really good. I think a lot of people are interested in this discussion, despite being the 20th of May. So please, you can continue sharing. If you want me to share,
all my apologies really for all those interruptions. Thank you, moderator, for being patient. So I was saying that this number 8 case of maternal death actually was a referred case from a CMA Mancon.
We cannot see your PowerPoint.
You cannot see?
Yes. Maybe just stop sharing and share again, or I can share it for you and you tell me if we need to move ahead.
Oh. Okay, let me share because I lost a connection actually.
Yes, good.
Okay, thank you. So this last but one case was from a CMA Mancon that had actually a postpartum hemorrhage and came with a very severe cervical tear. It was a really sad case because she was really pissing as we couldn't do anything and came and died some hours later on. The 9th case was a referred case from a naturopath clinic, actually management of septic shock due to criminal abortion. And actually they delayed because she started PV loss. The marriage in this naturopath clinic, sent back home, she still came back, and before she arrived us with postpartum hemorrhage and septic shock, it was really too late because she spent less than 24 hours and died. And the management of hepatitis. Hepatitis is a public health problem. And you can see that I'm happy that we have this hepatitis clinic. We've diagnosed, I think, more than 295 positive cases among those who were diagnosed screened. That is 9.2%, and 75 of them actually on treatment. And yes, and for this year, 2023, just the first 3 months, we screened more than 1,070, and of hepatitis B and C, we had 61 were positive. That is about 5.7% among those who were screened, and 7 were actually put on treatment by the hepatitis committee, hepatitis B virus, of course, knowing that, and B is actually, yes, more. So for this year, 2023, you can see the vaccination, because this has been another, the only center for vaccination has been the International Vaccination Center at the delegation. And so we actually also placed another center, another vaccination center in the hospital. And you can see the number of doses that they actually took, first, second, and third. Also for this, from January to March, about 60 persons took up, 30 had taken their third dose already. Mental health, when we talk about conflict in crisis zone, we talk about a lot of mental problems. You can see the now we have this rudimentary mental health clinic area. I said rudimentary because we don't have really all the number of staff that we should manage this center. And we have been waiting for the construction of a real mental health clinic. So you had 29 cases of depression that is in 2023. This is just the statistics for 3 months. Psychosis, bipolar disorders, 20, and of course, dementia, 31, and post-traumatic stress disorder, 71. And just in 3 months, 271 cases were received at this clinic. Gender-based violence, this is another concern. You could see that I could only give you the statistics for this first 3 months of this year, 2023. Cases of rape, 34. You can see up to 34 cases of rape that were brought into the health facility. Emotional abuse, 18, and denial of resources, 28. And of course, yes, physical abuse, 80, that is 84. Altogether, 171 cases of gender-based violence received in 3 months. This shows the effect of crisis on all this. 10 causes of diseases. Malaria can still come first. Oral diseases second. Peptic ulcer disease, gastritis is following. And you can see the other ones. And the last being the chronic heart failure. 5 causes of deaths. Sepsis is coming first. And the second is gunshot. You can see 89 cases in 2022. You can see that it's a major cause of death, and then chronic kidney problems and acute 53, like the third cause of death. You see that kidney failure is a problem, actually a big challenge with us. And our bed occupancy rate in 2022, 70.1%, and average length of stay 5 days. Total revenue, you can see. Yes, our revenue from 2017 has gradually been increasing. You can see because now we went into this PBF, performance-based financing, meaning that the Ministry of Health gave us some autonomy. We generate funds with all the price lists given by the Ministry of Public Health, affordable, and we have to use this now to to buy our drugs, buy our reagents, and then do many other things, even recruit staff. That is why you could see that we could locally recruit more than close to 300 staff, to manage the 400-bed hospital. And you can see this rise, though indicators were falling, the consultation was falling, but you had this increase in the indicators because we actually had the imaging center, our CT scan got bad. And so during that time, it was not easy to manage cases. And so many, when the ministry donated a brand new one, that actually increased the revenue. Yes, you can see, we went into performance-based financing in 2017. And this means that they were buying some of the activities we do. So we received, as total subsidies paid, 473 million, and a total unpaid, 82 million. Now, the program, the PBF program actually ended on the 31st of December, 2022 by the World Bank, and we still have some 82 million of unpaid subsidies to the hospital, but the promises that they will be paid. Poor and vulnerable, I think you see that is a big challenge with us. You can see that in year 2022, we saw 1,256 poor and vulnerable, and that amounted to more than 58 million of unpaid bills. Fight against corruption. Yes, the medical advisor, Dr. Ngwafo Samuel, is the president of the Anti-Corruption Committee, and we've held 4 meetings, scientific meetings, about 20, and I want to thank other specialists that usually come and take some topics and we discuss. I'm looking forward for the coming of our moderator, Dr. Foma, who will come and still handle some of our doctors or clinicians too on issue of the tumor or cancer clinic. And of course, perinatal and maternal mortality audits 8. Management committee, yes, we 4 meetings. We hold management committees every quarter. And recently, the city mayor is actually the president of the management committee. We write projects and then it's validated in the management committee and then we can carry them up. And recently, you know, the head of state said the regional hospitals and district hospitals will be managed by the regional assembly. So we are looking forward, by August, maybe the modalities for the transfer of resources will be actually spelled out by the Minister of Public Health, so that the powers will be actually devolved to the regional assembly headed by Professor Angwafo and his team, and they will continue to work together. Some achievements, I would like us to see more of them in pictures, yes, so that we can catch up the time. Yes, you see February 2022, you can see with the coming of the CT scan, this is the Minister of Public Health. I think after my speech, I was handing him the speech here. You can see him, the Minister of Public Health in the middle with his mask, and the governor of the region, president of the regional assembly, when they were inaugurating actually the CT scan. This is the CT scan. And this is the intensive care unit of the hospital that was renovated by WHO. You see my regional delegate of public health, Dr. Cheso Kingsley. You know, during the visit, we were at the isolation center, which I term Solidarity Ward, with 25 rooms. You know, in the heart of COVID, this was one of the buildings that the hospital actually benefited from the crisis. And we are at the delegation. You can see the Minister of Health, he was decorated here with his toga, and he was making his press interview. Yes, you all know this community project, public toilets that were made in the hospital. Actually, the roof had a problem, so we actually had to redo it. And this is just opposite the lab. When you visit the hospital, you can enjoy the toilet facilities. And WHO, a great partner, actually, you know, waste management is a problem. So they actually constructed another incinerator. But we saw that with the increasing number of major surgeries, just 2 theaters was not enough for the 11 surgeons. So we have to increase from 2 to 4 OP rooms. And this has been realized. And so this is the surgical block of the hospital. Yes, this is the center. We also paved this corridor moving to our Solidarity Ward with 25 single rooms. Of course, the eye department, we also acquire locally a refractometer, and we have 3 dental surgeons. So we acquired another dental chair so that all of them are to reduce waiting time, so that each person can always have his own chair to consult. And for the lab, yes, to reduce waiting time, we had this URIT 5160 for full blood count. We acquired it last year. And a new blood bank too, we acquired one, because more and more many people are coming to donate. And for managing attendance in the hospital, we have this biometric attendance register. Any staff you pass here, you have to make a fingerprint. We stopped it during COVID, and then I think when it dropped down, we've resumed the activities of using it now. And this partner, Plan International, through the funding of UNICEF, also saw it necessary to give us some public toilets, adding us that, and some water taps. So this was the inauguration. And this other brother, Mr. Tamukon Tumfon from Songwa, USA, actually donated us some 15 beds, wonderful beds, and we were so happy we received them last year. And recently, the ministry also donated us a mammography and a dental panoramic X-ray, I think pending installation any of the weeks ahead. And you can see Mubang Foundation, yeah, a lot of promises. Mr. Mubang, based in the USA, I think he came here, was during the doctor's meeting. You can see the medical advisor, Dr. Ngwafo, myself, and Dr. Mubang Joseph. He's presently here today. I saw him. He was around the town today to commemorate this day. Yes, end of year, we had this prize award. You can see the pharmacist. She won a prize at the national level and also at the hospital level. And the best GP, yeah, Dr. Neba Esther, and she was the best GP amongst all the 17 GPs in the hospital. And we are very happy that we've had invitations for her wedding coming up next month. Yeah, and the best specialist too, this is Dr. Mambab Alex, and moderator, Dr. Forba, you know him very well. I think he's been a wonderful guy. He's the one, you see, the delegate was handing. He's actually prized as the best specialist, and he's a nephrologist manning the dialysis center. So the Atia family also came because they thought they could also donate some prizes for some outstanding staff. This is the unit head of the theater. She works wonderfully well and caught the admiration of the Atia family, and they came up to donate. Even the ward church in the ICU, and this yes, housekeeper, this family donated some prizes. That is how it is. After the prize award, we can see. And as the moderator, you know, we have actually had some prizes. I think so. Some manager des hôpitaux. I think we had this prize too. We're very happy. And other prizes have come on in 2020. Other achievement. I think we are very happy with all this. And of course, the regional fund, the managing drug program in the region, actually gave the hospital the best prize for the hospital that has been doing quality drug management. Yes, we're at the level, those who know the hospital, this is just nearby the theater and the ICU. We saw a lot of carers actually standing in the corridors, sleeping in the corridors. I mean, it was very, very unpleasant. We thought that we should build a place where they can sit, you know, when they have visitors coming to have their carers, they could sit somewhere, this small row. And some past projects that I just wish to share with you people in a few minutes before I go to some our development plan in the hospital. Yes, this medicalized ambulance was acquired with local funds, and the ministry gave us authorization to acquire this medicalized ambulance. It's actually the lone ambulance that we have that is not 4x4, so it can't go to some places. And to say the neonatal unit, I think when I took over service, this was a unit of priority, and it was a cry of the pediatrician. Then we had to do some renovation works. You can see my regional delegate of public health, Dr. Cheso Kingsley, and the administrator of the special fund, Dr. Fondo. Yeah, so they were there to come and inaugurate, and the then medical advisor, who is now in Hospital Central. An infant welfare clinic, this is one unit we renovated, and it's now, this is the postnatal, you know, mother and child is a precious population that we cherish so much. We always want to give them the best, so we had to renovate this structure. When you enter the maternity gate, by the right, you see our postnatal. I think they have good toilets, and the wards are really clean now. The regional delegate of public health still came during the inauguration of this past project. This is the maternity gate. We have a security post here because we have about some 17 premier security staffs that are positioned on various places in the hospital. We're very happy that actually early 21, you know, when we had crisis in the hemodialysis center, you know, the minister gave us 8 brand new machines to come and alleviate the crisis. And so we have a cohort of about 80 cases with chronic kidney injury that are on permanent dialysis. You can see we were receiving the equipment, and this is the unit. And this unit is actually going to undergo extension of the center from 9 dialysis machines to 12, and renovation of the center. The city mayor, Mr. Achobong, you can see during the COVID pandemic, he donated some kit and also gave us a 200 kVA 3-phase generator to add to the one we had, because energy is actually a problem. Yes, we saw that mortuary, you know, when to give last respect to our loved one, the mortuary was not in the good state, and we had to embark on that project. We extended a new part of it. This is it, and this is how the mortuary now looks today. This has been realized already. What are our challenges? Yes, just permit me a few minutes now. Yes, we have this unpaid bill of PBF. The project ended, we still have 82 million of unpaid bills. Yes, 82 million, and I hope that one will be paid so that we can help us. 2018, we had 72 million of unpaid bill. We managed 378 poor and vulnerable. 2019, 38 million of unpaid bill. 2020, 31. 2021, 38, and and the rest follows. And just in the first 3 months of this quarter, 2023, we had 11 million of unpaid bills. You know, when we have critically sick, our priority is to serve life first and then money after. And we have a social service when they say these people are actually poor and vulnerable. That has been a major challenge, you know, to recover, because we have some autonomy. We manage these funds, and when they go unpaid, it tends us to reduce our drugs in the pharmacy, and we have challenges. So we also have challenge in, the energy, and a lot of power fluctuation, voltage fluctuation. And so we use a lot of fuel to always fuel these generators. And of course, some structures still need some rehabilitation. And of course, I will put it, you see it in the development plan. And kidnappings and harassment of some staffs on phone has been there too. And of course, increasing number of kidney failure. Recently, I think you saw the press release of the regional delegate about people who consume a syrup, nature cool syrup for cough, a cough syrup, and then ended up, we had a 17-month-old child with acute kidney failure. And hemodialysis, we don't do. The pediatrician, Dr. Khan, had to continue try with the surgeons to do peritoneal dialysis, and unfortunately, we lost these 2 babies that came from Douala, because actually they consumed this syrup in Douala and came over. So this issue is a problem that we need to communicate to our population. Wine, spirits, a lot of adulterated wine and spirit now on the market. People are fabricating them in the quarters. You don't know what it is. And when people drink, you don't know the concoctions too. Taking this, somebody is drinking liters upon liters, treating typhoid. You don't know what is it. Yes, we are not saying that we're against traditional medicine, but I want to think that there's a lot of quacks that have infiltrated, some with supplements. And that I would like to share this with our brothers and sisters in the diaspora. We have seen patients who carry tons and tons of containers, tins of supplements. Somebody who is eating well, taking fruit, and what are you supplementing? And many of them, actually, when it comes, especially from our brothers and sisters from the diaspora, and you find some of them, we think that we should really talk on it and see what we should take. Yeah, so, and yes, another challenge has been gunshots. Healthcare in conflict zone 2022, you can see all the months. Gunshot received at the level of the emergency. We've always received a case, 162 cases of gunshot in 2022. And those that were received straight at the mortuary that came, they had no time even to take them. 89 cases of deaths from gunshot received at the mortuary last year, 2022. And of course, this first quarter, gunshots received at the casualty every month, 27 January, 10 in February, 3 in March, 40, and those received, at the level of the mortuary, 20. So it's still a problem. You can see this is my residence. You see, I had an impact of a bullet on my residence. You can see this is the bullet here we will speak. I'm happy that, this colonial master built this building with stones. You can see that it couldn't penetrate. So. And you can see a window of the hemodialysis actually received some bullets. When there's crossfire, we have a security police station opposite the hospital, and at times we are in crossfire, and you can't imagine what can happen. And we've also received a lot of cases. Somebody stands in its corridor, and a stray bullet picks them in his or her corridor, and we have been receiving cases like that in the hospital. And the level 2 of the postnatal window, you can see this bullet actually passed through the window and then lodged in the box of a mother. This is the box of the clothes. You can see that hole here. That is where the bullet went in, and she could find the bullet in the box. So these are some of the challenges. What are the envisaged projects for the hospital? And I'm happy anybody can pick any project. This is a community hospital. Anything you think you can do, you can take any of the projects and you carry on. Yes, we have outpatient department. That is where majority of the doctors consult. Yes, it actually needs some renovation, and this is it. So some estimate was done, and for equipment, it's about 18 million, and for the infrastructure to put the offices in top shape and put toilets in the doctor's offices, it's about 36 million. And then now the labor room and the ANC, I think this is all this unit to need some facelift, need to be refurbished. And the equipment will be about 3.2, and the infrastructure about 30 million from what the engineers evaluated. And this one, the female surgical ward, the D ward, which we had stopped for some time, also need some facelift. And you can see the structure. Yes, the equipment will be 8 million, and just the infrastructure about 35 million to do it. The new private rooms, where our VIPs, I think we see that it needs some facelift too, and equipping it about 8 million, 25 million for the infrastructure. And the laboratory, which is really small and tight, and we think that something should be done to this laboratory, and the evaluation shows that adding some equipment will be 31, and then the infrastructure about 30 million to make sure that all the departments are actually spacious. And of course, we started this project and COVID came and stopped us. We wanted to add more offices. You know, when you hear about 50 doctors, you know that it's not easy to have offices for some of them. So this project is still to be completed, and equipping it at 6 million, and to finish it, we had to make a L+1. So to put another floor on top of it, that is it. And of course, the kitchen and of course, the laundry department needs also some renovation, and the equipment will be at 1.7, and then it needs about 20 million to have this unit actually. This pharmacy store is really tight, and we think that we need to extend a pharmacy store. And this the structure will cost us about 22 million. The hospital fence, you see that the fence is actually old and needs some refurbishing. Yes, some parts of it, and we think that doing this is a very big. When you hear a whole quarter, is like a quarter. If we could do it, would cost 35 million to do the entire fence. We have started doing maybe doing just some 10 meters gradually, but finishing the other part will cost us about 35 million. And just to say, the regional assembly has a mega project for the hospital and a modern emergency center. Feasibility studies have been done, and of course, doing maturation of this file. And this is a project that will be funded by FACOM. It's over 500 million, and we are looking forth because they will do two for the region, one in the regional hospital Bamenda and one in the regional hospital annex Kambe. So we are very happy with this project. And now other equipment that we think that should be done in the energy section. We need a 4x4 ambulance. I think on the general wards, we evaluated what we could need again to make this ward very good. And of course, I will not belabor, it's almost 1 hour, and human resource. So I will just skip this. And to say in summary, this is for the infrastructure, we need about 257 million. And then for the equipment, about 956. Just 650 itself goes into the, this solar energy for the hospital is about 670 million. If we have to electrify the entire hospital to carry all the equipment, including the imaging center with the solar panel. So it's carrying in this equipment 670 million. I think that is the heaviest. We are looking forward. I think the regional assembly is interested in this project. We're happy Dr. Ndufo Terence of the USA is the one who did that study. I think he did that study in this renewable energy, and we're happy. You see, we have this, we spend about My role in the hospital is actually not to recruit, but I spend 15 million every month to give stipends. I call them stipends, not salary, to the other staffs in the hospital. So plans for 2023, I think most of them have been said. We'll just insist on the universal health coverage that was launched in March. You know, consultations free for under 5, free malaria treatment for the under 5, no user fee. I'm happy His Excellency, the Minister of Public Health, was one of the invitees in this, our town hall, and did present everything. At the level of the regional hospital, I think is this first phase that is ending on the 31st of December, the free consultation for the under 5, we are not part of it. It's only the district hospitals and the health centers. We are going to the HIV-free project and TB and hemodialysis sessions, and our hemodialysis patients are already benefiting from this universal health coverage first phase. So I think that is it. And of course, Mr. Mubang Foundation, I think they have, we are expecting a lot of equipment. They're working on it to bring it from the USA. And of course, that said, we want to give thanks to all those partners that have been with us, even well-wishers, especially. Many people come to celebrate birthdays in the hospital, and they just go to the social action service, and they can pay some bills of some people. You know, that is what we've been very, very happy with. Some people who just want to celebrate their birthday or anything, and have seen the hospital as a place where they can come and assist. We have some hotline numbers, the ambulance number, you can call this 24/7. You have the customer service, emergency, COVID-19 center, imaging center, listening and orientation. For GBV, you know, you just call this number at any time you've had an harassment, and yes, you have been harassed, and then any case of rape or what, just call this number, and then the partner doctors of the world, MDM, they're partnering with us to take care of their medical bills, psychosocial support, and even the legal follow-up, and of course the mortuary too. And thank you very much for your kind attention. I think we extended. Okay, Mr. Moderator, that is where I will end my presentation. Thank you.
Wow, that's all I'm gonna say, like, wow. So what I can say is your transparency will lead to the transformation of this nation. Because what you have just presented here is real transparency on how hospitals need to be managed in Cameroon, what we need to know, what is happening. This is presenting to your people in a period of crisis, how you've been taking care of the hospital and being as transparent as possible. Because I've always said, when I was doing my residency in Cameroon, every day I wrote in the suggestion box, the toilets are dirty in CHU. I'm going to say this public. I wrote that every single day, each of us who were residents then, because we thought that a big hospital like that could get more. I was a manager then from a district hospital and moving over to specialize in a referral hospital that I did not see that it befits becoming a referral hospital. And I'm one of those who feel that in a system, no matter how things are, few good people can make changes that others can emulate. And I just want to thank you for the presentation you've done today. It has helped us, it has enlightened us. That's the regional hospital I met before crisis, looks better than the one I actually met when I was working in Bamenda back in 2008. I was posted to that hospital. Everything that you have presented looks better. That's from an approach from someone who worked in that hospital. And it shows that there is a bright leadership which is willing to move things forward. I'm not going to spend my whole time talking. I became moderator by default today. So I'm going to pass over the mic to Elvis to see if he has any contributions to say. And also Elvis, please.
Hi, Chair. It's really a wow presentation. And Doctor, we are really, really delighted to have listened to your amazing presentation. Just like Muno said, the word is how transparent you are. and how committed you are from every aspect of your management, from the human resource perspective to infrastructure, to process and flow and everything. It's really amazing. It beats my imagination how you manage to navigate through all the different challenges to gain this kind of support that you are gaining even from civil society. I think it's one of the first time I see individuals really just coming and families coming to just donate or give prizes to the hospital. It's a kind of a culture that had not been there for a long time, and you just, maybe your leadership have ignited that kind of an interest. And I think the town hall for healthcare professionals is just an excellent platform to actually do this kind of a presentation, because I think that lots of people in the diaspora will think of how they can support you. We have seen your presentation of needs and things that you plan to do, and I hope that a lot of people are going to watch this presentation. I can assure you, Doctor, we are 1,750 town hall members on our mailing list, and we are going to make sure that this particular presentation really gets the widest of visibility on our channel, on the YouTube channel, and on our mailing list, so that people all over the 35 countries that are represented in the town hall can see what you are doing and see in what way they can support. And I know there was one of our presenters, Dr. Roger, who is one of the I would say directors of Africa project at MedShare, and I'm sure he did a presentation on just how hospitals like yours can benefit from a medical equipment donation from MedShare. And I know in the past some other organizations have done that to donate to the hospital, but I think your presentation is really one that he will be very interested to really see, and other people who can put together $25,000 and approach MedShare can actually make a huge contribution of medical equipment donation of a 40-feet container that can be worth 300 million francs CFA to your hospital. And cultural and development associations should really watch this and see how they can raise funds during their annual conventions and think about places like the regional hospital that are really important to benefit from your support. I really can go on and on and on because it has been an excellent presentation, but I just want to add my voice to that of the chair to say thank you. Thank you for your leadership. And we still really believe that good people like you can bring about change in our nation.
So thank you, Elvis. And I would allow Dr. Dennis to respond. If you have questions, raise your hand. I'm just going to call on the other moderators. And Elvis, are you going to take away the moderating from me, or I continue?
You are doing an excellent job already, and you can go on.
Okay, so before we call on, we just give time for Dr. Dennis to get a little glass of water, and he's been talking for an hour. I just want to get a reaction from those in the house. I see Dr. Dieter Ivor, who knows that region very well. I would love to call and let him tell me his reflection about what we can do.
Thank you very much, Mr. Chair. Dr. Nsame, there are really no words to describe the work you are doing. And more specifically this week, I had the opportunity to communicate with you on a patient at a regional hospital, and the help and support and rapidity with which you responded to my appeals was really heartwarming. And for that, I want to personally thank you for all you're doing. When some of us went into medicine, what inspired us was the hope that we would come back and help our people. By our people, I mean the people of Bamenda. When I looked around and I saw how challenging it was, how difficult it was, how people were dying from simple things that I thought could have been managed with no struggle, it really hurt me that much. Unfortunately, some of us are now sitting comfortably in the diaspora and can only throw out very harsh words when some of our brothers back home present work or make a mistake. I want you to know that we sincerely appreciate what you're doing. And we will do our best in any way possible to support the efforts that you are putting in. I guarantee you, if everybody in the diaspora was to come together, all what you've presented in terms of money can be done. So again, I don't want to take too much time from this meeting, but I just wanted to tell you, thank you. Thank you. We are right behind you. Keep going. And anytime we can be of support, and I'll be reaching out again on a more personal level to see how we can work together and move things forward. So thank you, and I wish you a wonderful Q&A coming up soon.
Yeah, so just short reflections from others that I know who are here, who have had, Dr. Brunhilde is here. Brunhilde and myself work with Dr. Sama during the COVID pandemic. Any reflections, Dr. Brunhilde Santos? Okay, while waiting.
You're muted. You're muted, Dr. Santos.
Oh, sorry. Sorry, I had to park. I'm driving. I just picked up my daughter from the airport, so I'm sorry. So, well, Dr. Nsame, I actually second everything that Dr. Dita said. He's very personable, and I'm telling you, very, very ready to cooperate with us whenever we call for help or to give our assistance. And I've seen the presentation, watched the presentation. He's doing a marvelous job, and it takes someone with special characteristics to be able to pull everything that he just showed us. I just, I also would want to learn, whatever I can do. I see that, I looked at the statistics which he presented, and sadly, sepsis, septic shock is really high up there as cause of death, which I think you can even, the renal failure and the other causes, leading causes of death, it could also intertwine with even the sepsis and septic shock. I will also give my, I'm available if there is anything that I can do on my own, from my own end in terms of lending my own services to help in that regard, given that my background is critical care, or one of my backgrounds. So I can, I can lend my service in that sense also if needed. So, we can talk behind, and you just let me know what I need to do.
Wow, thank you. I want to thank you too for your service during the time of the COVID. I know we used to join a lot of town hall meetings and back in the day. So thank you, Dr. Brunhilde. And now I'm going to call on Dr. Kate and Dr. Brian. Can you lead the session for question and answers? Is that okay?
Yeah, thank you so much, Mr. Chair. Everybody's calling you Mr. Chair today, so I'll go with the flow. And our senior Dr. Dita really said something important. And people working on the ground in Cameroon and working in, I don't know if we can really imagine working in Bamenda over these past years. And I'm just so thrilled to see what Dr. Same has been able to accomplish. It's mind-blowing to see all that has been done. And I think when you were talking in your introductory message, you said he's got an MBA. Probably that's why he's got good managerial skills. But I know many people who've got MBAs and masters and all of that, but they can't do what he has done. I think this is a personal and life skill that Dr. Same has, and really many other people. And this hospital management is very critical in Cameroon. And we doctors, we usually say doctors are our own problems. I know doctors are problems to doctors and to healthcare in Cameroon. But to see what's happening in Bamenda, I happened to work in Bafoussam when I left medical school. And I was so opportune to also have a visionary who changed the hospital completely within a short period of time. And it's possible to effect change in Cameroon. I think this is a classical example that things can be done and be done in the right way. I think I just want to I don't know if I can ask one question now, Mr. Chair, to Dr. Same.
You can ask your question. Yes. Let's start after this.
Okay.
I'm going to call on ER and was up first.
Okay.
Ask a question after you. Yeah. So you can start. Let's start the question and answer session.
Sorry for pushing you rapidly to that. So I just wanted to ask Dr. Same, what I think you mentioned that you've got about 50 GPs, if I'm right. 50 GPs at the moment. What's your opinion or what's your feeling? What's your is it a good number to manage the work on the ground, or do you think you need more? And in case, what are some of the strategies you're putting in place to attract? I know you're already keeping over 300 staff, which are not permanent government employed staff, but what is your take around that number of GPs? Because I know GPs in such a big hospital are key to good functioning. So that was the question that was in my head, and probably others will come as we discuss.
Yeah, Dr. Same, I don't know if
Dr. Same may be muted. Okay.
Oh, okay.
Okay, thank you. Maybe the last question again from Dr. Jean-Claude. I did not get you well. I think it was an issue concerning the staffing in the hospital. Please, can you just repeat your question, please?
Yeah, sorry, probably connection. So I was just coming back to the point. I think you mentioned that you've got 50 GPs, if that number was right. And is that number enough to do the work that you guys are doing in the hospital, or would you think you would need more GPs? And what are your strategies maybe to attract more, or maybe there are too many, and what are your strategies to exclude? I don't know. Okay, you said 17. You said 17.
Thank
GPs.
you.
Okay.
Yeah, 17.
Okay.
Okay. Thank you very much. Yeah. Let me just keep my video muted so that maybe my connection remains perfect. If you can get me.
5 on 5.
So, Dr. Jean-Claude, let me start from you. Yeah, let me start from your question. Yes, staffing is really a big challenge. You know, it's a state-owned hospital. And normally I was just to request to the ministry so that they give me the required staff I need for a 400-bed hospital. But you can see for yourself that I can't manage a hospital with 156 staff, you can imagine. And once you talk about the GPs, you know, there are 17 and only 6 are state employed. And you know, I've had to take again 11. And I'm happy with an idea that came from my medical advisor, Dr. Ngwafo Samuel, the neurologist. You know, he actually said we should get some house officers. I think we've started some house officers in the hospital. We make sure that each ward has a doctor that is permanent in the ward, you know, to react to concern of the patients that are admitted, and then he can relate to which other specialist is needed. And that has helped us to give some customer satisfaction. And so you can see that we have this 11 doctors recruited locally. And you know that all the training schools now in the country, there's no more direct recruitment. So you find them coming up, and it's unfortunate. Every year we have to review the staff. All the staff we recruit locally. It's unfortunate to to fire 11 staff and 1 doctor. It's just unfortunate that when there's no performance, and then we have to do away with you. And I think that it's a very good thing when we start going to private, when we own. if this hospital is actually decentralized to the regional assembly, that we can recruit who we want and fire, those who are not performance. I think that will be wonderful. And we hope that with this decentralization and region, because you see at times my regional delegate, all the 20 health districts in the region, there are problems, human resource. I think the ministry was saying that it has there about 30, the needs are about 35,000 needs in the Ministry of Public Health in the entire country. And so it is not easy. And of course, it's only by decentralizing and saying that, well, let us recruit who we want, and then maybe put the offer, and then people apply. If you want to work in Jikwa, you apply for Jikwa, we need a doctor, then people apply, and then you go there. I think with this conflict, many have been transferred and they never showed up. And this is, I'll again take this opportunity to thank my staffs who have stood the challenge. Many have been kidnapped, many have threats, many have not slept in their house. And then because of this crisis, because of things, it's not easy, on both arms. You see, at times you just sit. I remember when Dr. Zama visited the country with his wife and his friends, he was in the hospital, I think it's about 3 weeks ago. We moved around the hospital. He consulted, went and saw a patient in the intensive care unit. I was so happy. He consulted this patient who had actually a cardiac problem and gave, edify and beat the team, and it was wonderful. But just that evening, there was thunderous gunshot. I know, I don't know how Dr. Zama slept that day, but we are already used to. At first, when there's gunshot in town, the market closes. You see everything shuts down. You see, today was our national day. You can't get a taxi. You can't get a bike. You can't imagine how people went to the grandstand. So it's a challenge. And days like this, imagine, how do I manage those 519 staff on ghost town days? How do somebody move from upstation? I have to convert some of the ambulances into transport vehicles, put transport ambulance for personnel, because on these days, these are vehicles that can move. So we have to move down and pick. And you see, I'm happy that majority of the staff too, maybe they stay closer, those who can walk, because ghost town days, we walk to the hospital. Everybody is on foot. So we do exercise, we move to the hospital, and indeed, that is it for the staff. I want to really thank all of them. Some of them are connected here, and I always do that because I know they've actually stood the time. Many doctors have not come, they have been transferred, and they've fought their way, and then they've gone back to other places, some out of fear, some just because they say they are Francophones, especially, they are too afraid, and it has not been easy. So I would also like to share, I think I got this comment from Dr. Elvis Ndasi. Yes, MedShare. MedShare has actually donated some equipment and material to the hospital via the regional assembly. I think all this was donated at the regional assembly, and they shared not only to the regional hospital, but to other health facilities around. I worked with the regional delegate of public health, and some of the material, the medical supplies were sent to other health facilities within the region. And so we really hope that cultural association, they should know that this hospital is the community hospital, and that is for the community. It's for our people. Anything you can do. If you think you can renovate something, a ward, you just do it. You see, we have the Well Fund Pharmacy, and then we can even name a ward after your family, if the family wish to do something for the hospital. I think it's open. Don't be afraid that saying that it's government, there's any procedure. No, it's just the management of the hospital. If you have anything to do, you are very much welcome, or any donations. And then also from Dr. Ivo Dita, yes, thank you. I'm very happy we talked, our gastroenterologist, he talked about your patient. I think another challenge is communication. Our colleagues don't communicate. I don't know whether it's the same thing over there. You find a patient is in the ward rounds, you discuss so well, do your sessions, brainstorm, but the beneficiary is not even informed. In the end, you take your decision, And then you go, okay, oh, they have said, do carry these instructions, and the doctors are gone, and the nurses only execute. In the end, you don't there for hospital, how many days, 2 weeks, you receive waiting. They never tell me. And so this is another challenge that we should share with our colleagues, that we need to communicate a lot with our patients. And at times the carers, yes, it's confidential. I know that at times they are worried when they have to share the information of a patient with a third party, because some at times want to know for other reasons. But if a colleague is calling, like when Dr. Ivo called, he has a patient. I mean, that is it. There's some shared confidentiality. We can share something to a colleague. But when it's somebody who is not of the field, I think you can be hesitant to say, but who are you? You can get to your patient and he can tell you. But when the carer tells you, I've gotten to the patient and he says he doesn't know. What do we do? Same as Dr. Ivo was there, he has his patient who has been in the ward, female medical ward for a couple of times, but the patient could not tell the doctor what he was suffering of, even though he had some past history. So thank you very much, Dr. Ivo. I'm happy you also chatted with Dr. Nwafo Samuel, and he gave you more insight about your patient. And I want to thank all those the appreciations from those from the chat. I think I thank all of you, and also thank Dr. Brunhilde from the COVID era. Was really not easy, and your input how to manage oxygen therapy. I mean oxygen rebreather mask. I think we got it from you guys, and we were very happy. And we have some sporadic cases still helping us. Thank you.
Wow, thank you very much. I would call on Iya before I give a follow-up question. I want her to ask a question. Iya has the Iya Foundation. She's been doing a marvelous work in Cameroon. Amazing job. For those who don't know, I've been following her for more than 10 years, and I've seen the wonderful things that she has done. So I would want to hand her over the mic and see. I'm sure her questions may have something to do with dialysis.
Yes. Thank you, Dr. Kene. Hi, everybody. Hi, Dr. Nsame. Thank you so much for your wonderful presentation. Your transparency and clarity drives home a lot of knowledge for some of us here in the diaspora. So my name is Iya Bekondo, and I am a dialysis patient. I had a transplant. It lasted 16 years, and now I'm back on dialysis. A lot of my interests around dialysis are kidney health awareness, dialysis, and organ transplantation. So my question is about dialysis. You mentioned peritoneal dialysis that was going to be done for the baby that unfortunately had passed. And I really wasn't aware that peritoneal dialysis was being done in Cameroon. Is that a renal replacement therapy that is now picking up pace in Cameroon? I'm just curious. Is it being done in Bamenda or something? I'm quite familiar with the dialysis clinic in Boya, because we actually have a kidney resource center right in Boya. I run a foundation called the Iya Foundation. We promote kidney health awareness and support dialysis patients and clinics. So I'm quite familiar with the Boya atmosphere environment, but not quite sure with Bamenda, even though we just recently had an event in Bamenda in December. So I'm just curious, is peritoneal dialysis something that is picking up pace in Bamenda?
Okay, I think Dr. Dennis is muted. So if he can unmute himself. Oh yeah, he's speaking, I'm sure, but muted, yeah.
Thank you, Mr. Chair, and thank you, Iya Bekondo, for that wonderful question. I mean, it was a challenge because Dr. Mambab said, you know, actually a dialysis session is actually, I mean, it should be almost 110,000 or so, the exact cost. And of course, patients have been contributing 5,000 for their sessions, even though this is just a tip because they do a lot of laboratory workup. And even those when they need blood, you know, they have to make a contribution. Peritoneal dialysis is not in the national program in all the dialysis centers. I think we can only see in Mbingo Baptist Hospital that have been doing peritoneal dialysis there. But what we have been doing is only hemodialysis. And the kits that are supplied for the dialysis center is only for hemodialysis, not for peritoneal. So it was a challenge that Dr. Kate, our pediatrician, Dr. Kate, who had worked a lot with the Baptists and had some knowledge and have managed some cases in Bingo, had to even use her experience, work with the surgeons, because it needed the surgeons to place some catheters, some abdominal catheters, and so that they do some sessions. That was what we do, but it's not really practiced in the hospital, because Dr. Mamba said, well, there's nothing he could do. So pediatrician worked with the team, the nephrologists, and also the surgeons to see how they could manage this, because we're helpless. The child, we did not know what to do. It was really a big challenge out of this syrup. I think analyses are still going on so that we get the results. What was in this cough syrup? We might have had a genocide, might have been going on, and we don't know. It is terrible to see that just a cough syrup. And I think people, the products were arrested in Douala and all the same. We were managing, trying to see whether we could send those specimens. But now you want to look for the specimen that is all gone. Nobody is saying, oh, I don't know where those things are. But I think the regional delegate of Littoral and Northwest, they've been in touch and seeing how they can do. Because for children, it's a challenge. With peritoneal dialysis, we don't have the kits for it. Thank you.
Yeah. Thank you so much, sir. And just one last question. I know with the rollout of the universal health coverage in Cameroon, they had talked about making dialysis free for the patient. Has it already been implemented in Bamenda?
Very good concern. In this first phase, only the sessions have been exonerated. The 5,000 the clients have been contributing. But they still pay for their workup if they need blood, but locally, we have subsidized some lab workups and blood transfusion. Yes, and then buying your catheters, you still need to. If you go and put a fistula with the vascular surgeon in Yaoundé or Douala, they still have to pay for. Only the 5,000 has actually in this first phase. Let's hope that after the 31st of December, probably the ministry might see when many more financial partners will come in, or when families will start to contribute to this universal health coverage, probably other things may come up.
Okay, thank you so much, Doctor. Yeah. Thank you.
Yeah, so just a follow-up question.
Okay.
Yes, so Dr. Brownhilda, please, you can go, please.
Yes, I also have a follow-up question. So in this particular case where the child, you talked about the child needing peritoneal dialysis with the surgeons, working emergently. Now, since your hospital already has the capability of doing hemodialysis, I don't know, have you thought about, or because in situations like this, instead of putting the child through maybe a more invasive procedure, is there a capability of putting in a temporary dialysis access, which is the same like putting in a central line, but with just a bigger catheter, and then instead run hemodialysis? Do you have that? That's because I think it will probably actually be easier and even less traumatic for the patient to go through, do a PD catheter. And if there's a capability of doing, it's the same thing as putting a central line. It's just using a bigger dialysis access, and then you do dialysis, because this will help situations like acute toxicity, hyperkalemia, or some certain situations where the patient has to be managed critically. So Dr. Nsame, do you have that capability of putting in a central line or having the bigger dialysis access, which you can do temporal dialysis, which you're more familiar with?
Oh, thank you, Dr. Brownhilda. I think this is a good discussion that I will do, because I remember when I talked with Dr. Mamba, he said, well, they don't do means, and I think we might.
Oh, sorry, Dr. Nsame, can you unmute yourself?
Oh, sorry. Well, thank you, Dr. Brownhilda. Thank you for reminding me. Yes, I think that is some other things we will discuss with the Chief of Service, Dr. Mamba Balex, I think we'll discuss again in the background this issue, because we might have other cases and know that these kits are actually just supplied to us. And just said the kit for children is not available, and that is it. And we know that they give to a contractor who supplies the kits, since we don't buy it ourselves. You know, like the hemodialysis. So we'll discuss again in the background and with the team at the hemodialysis, Dr. Brohita.
And to tell you the truth, though, and that's why I said, if you guys need expertise, I'm available, because even though they say for children, some of those catheters, they have different lengths, 16 centimeter, 13 centimeter, 20 centimeter. You can easily, with the resources you have, even for the children, you may actually use a smaller, a smaller length, like says 13, and use it and go through the femoral access, and that will still do it. So,
that will still do.
So I really, really think that, as much as, the limited resources you have, and you guys are doing a great job, but I think, having worked with you a little bit, I think one of the challenges that you have may also be maybe someone to give suggestions as to maybe how to manage some of these patients, because the time is really of essence in survival in situations like this. So I'm still saying I'm available. If you guys need me, my own little contribution, I'll be very happy, because I think there are a lot of situations where the patients can easily, their survival rate or their outcome may be better just with few suggestions.
Really,
Thank you.
really. Thank you indeed. I'm so happy.
My next question was I'm just going to do a follow-up question, which was gearing towards that. It's about collaboration. It's more about collaboration with the internet, and I've collaborated with Dr. Tame before. It was a wonderful collaboration. Several times, he's going to tell you several times. And I think if we can, the regional hospital in Bamenda can be a satellite where we can also connect with the diaspora, different specialists with the diaspora when we have certain challenging cases. We can get challenging cases and correspond with the diaspora and see if we can have an input into such challenging cases. And it's going to be important for you as the manager of the hospital. Is this something which is possible to tell your staff if they can be able to reach out? And we can also the diaspora needs to create a bank of doctors or people who can actually give ideas, and we can run ideas about how we can do in situations like this. So my question is, what are your needs in terms of human resource? Do you need more general practitioners at the moment, or you need all? You need more specialists, you need more specialized nurses, you need more specialized laboratory technicians in different aspects, or do you need general laboratory technicians? I'm saying specialized nurses because nursing field is one field where I grew up in Cameroon, but it's highly non-specialized in Cameroon. Meaning we don't have chemo nurses, we don't have cardiac nurses, we don't have a lot of specialists that can work at different areas. So this is just a follow-up question before I get to call on the others. In terms of human resource, what can you benefit from the diaspora?
Very wonderful question. That is the #1 challenge, as you rightly say. Actually, the benefits we really need in this human resource, I think, yes, you can see the number of GPs we have. If you need, I think these are the first contacts. We really need more GPs and specialized nurses. We are really lacking in this. Yes, as you're talking, specialized in anesthetic nurses, nurses in, reanimation, in chemo, things like that. We lack. You can't imagine that now our nurses who are working in the hemodialysis center, they've had some training, even though not like a formal training to have a certificate, but they have been trained to work on particular machines. So when we even moved from one other machine to Nikizo, it needed all another training. And things are so dynamic the way things are changing today.
So we can say we need specialized nurses that we really need from the diaspora and more GPs. I know that with the university teaching hospital, you know, those specialists are on off. That is another, because they are not like full-time. You find this one comes on this day, this clinic day, you have the cardiologists, they're all based in Yaoundé and Douala. They come to work for 1 week and then they go. That is another problem. But some of the cases we do discuss. We have a group of a clinical group where we discuss a lot of cases. You find the dermatologist, she comes maybe once a month. So you have to keep cases. But really intensive care, I think we are very happy that we need a specialist. Dr. Ndifo has already been transferred, Dr. Ndifo, who is doing a commendable job. The lone anesthesiologist for the entire region is Dr. Ndifo. He's the one in the ICU. I'm telling you, that is when we had to see parenteral, feeding, which was really new. And he's now training the other nurses in the unit and trying to keep now the theater. The lone neurosurgeon we have, you find Dr. Chufo, who is doing all this, but he needs actually another, because Dr. Ndifo is overworked. Actually, he's really overworked as the lone anesthesiologist to man all those big operations that will be, that is going on. So I think I've put some needs in this slide, but just to say we need more of specialized nurses, more of GPs, and just some few specialists who can manage some of the pathologies that are really very much common around us. And of course, we can't manage everything. That is why we need other higher level where we can refer to other places. Like you see, we don't manage cancer in this hospital. We can only diagnose, see at what level we can do. And then we refer to oncology center, where we have just Hôpital General Yaoundé and Douala. You see, I know that Bingoto has been managing cancer. I think that is it. I've not yet visited the oncology center. And these are some of the, we should know our limits and know where we can go and where we should refer when it's absolutely necessary. Thank you.
Well, thank you very much. I'm going to call on Gilbert Ngwane. Please, you can unmute yourself.
Yeah, thank you, Kenny. And thanks, Dr. Same. Listening to you is really been amazing. Coming in to follow up what is happening in Bamenda. I want to especially thank Dr. Jean-Claude Cade. I crossed my path with him, and knowing that something like this is happening is quite interesting. I'm Gilbert Mickey. I'm based in the UK and currently running an organization for Community Vision Group. And our focus essentially is on school health and nutrition, but we decided to accompany our programs with two critical programs. The first being viral hepatitis B. And I'm very happy seeing the statistics that you've presented, which is catching a lot of attention. And we, as Community Vision Group, we operating in Cameroon and in Malawi. And my attention as a Cameroonian is to see that we have some of this real-time infrastructure for viral hepatitis erected at the level of Cameroon, especially in Bamenda, where we have started up operations. And so I have two key questions to you. And the last question will actually be an open check to see how we can come in to collaborate with you. And my first question would be, following the statistics that you've provided, what are the efforts that are being made to actually ensure that there is appropriate linkage to care to the positive cases that you already have? I saw 56 for hepatitis B, and I saw 5 for hepatitis C. But our focus is hepatitis B for some particular reasons. And so I'll be very happy to know some of those efforts that are already put in place to ensure effective linkage to care. The second question would be, if we needed to work with you in the area of viral hepatitis B, what priority areas will that be? So that will be very okay. And at the end, it's okay. I'll leave my contact with you privately so we can connect. If I'm in Cameroon, we can quickly catch up to talk physically. Thank you.
Wow. So Dr. Dennis, please, you have the floor. Unmute.
Thank you, Mr. Chair. And thank you very much, Dr. Gilbert Nguane, for this wonderful concern. Actually, there is no real program, hepatitis program in the country. That starts from there. That is number one. And you see, we've been trying to make sure that the hepatitis committee of the hospital actually goes functional. There's actually a small, let's just say there is an activity going on in the ministry, but at first it was just like managed by gastroenterologists. But when you see the ministry per se has not really brought up a very strong program for the management. That is the number one challenge. And the second thing is that what are the efforts we have done to ensure linkage? Yes, very important. Because you diagnose somebody, by the time you say, oh, this is the panel you have to do, they disappear. And so what we've done to track people is actually to open this registry. We have a focal point. Immediately you get a positive case. Whether you know is active, whether is that the person is eligible or not from the start, we open a file so that we can get all the contacts and then we can track them. We can call if they are lost to follow up. If somebody has not come to the clinic. And I was just discussing that with you know, the members of the team. All the doctors at the OPD and the internists, they are part of this committee. We meet every month. When you have a file, you present the file in this committee. You know, just as we started HIV management, and now you saw that rules were even delegated to nurses, and you find that today nurses even put on treatment. We want to start like that, and so that we have the minimum. Because when they tell you, this is the panel to do, oh, you have to do this ultrasound, you have to go and do this elsewhere. When the gastroenterologists give a panel and they see that 100 and something thousand, you find that they are lost to follow up, especially people who are healthy. You know, our population, when somebody just came for he was not symptomatic, he came to donate blood and you discovered it, but he just came for a medical check and we found hepatitis B positive or so. And then you just have this, that is how some of them just disappeared because it's actually not subsidized. But the medication, we also discussed that in our management board because you have to go and pay in the bank and come to the hospital and take your medication. You want to take tenofovir, you go and pay your 4,000 in the hospital. But if it's for hepatitis C, I think the minister has subsidized it again by 50%. It was 50,000 for a month of treatment. It has dropped to 25,000. So, Dr. Gilbert, what I think we can really collaborate is actually, you know, discussing this cases. We know that you can have it and not everybody will be eligible for treatment. Know that when you put you on treatment, it's a life treatment, except maybe some like hepatitis C where you can actually be treated and you're cured. So I think I'll get your contacts and I think I will share it with the committee so that we can continue to discuss in the background. Thank you.
And I think that is the goal behind the town hall, to get collaborations so that we can improve the healthcare of our people back home and be able to enact change back home. So I'm going to call on George. Please, you can unmute yourself.
Thank you very much, Kodo. Actually, I don't have questions. I would just like to do more of testimony because I've worked with Dr. Same. Thank you. When he was transferred to the regional hospital, I was project manager for the HIV-free project funded by PEPFAR and supervised by CDC, implemented by the CDC Health Services. And there are some 2 points I noticed to show how much of an open-minded person and a grand friend he was. The first point he mentioned about using the ambulances, but I think You have to know that every Monday, Dr. Nsame dispatches his vehicles in the town in Bamenda up to my 5 to bring the staff to the hospital, just to make sure that the regional hospital is functional on a Monday to receive all the casualties. That touched me because in as much as we know how dangerous the town is, some of them trek, but he mobilizes the vehicles. The second point, there was a supervision from the high level, and they sent in 2 senior staff. And Dr. Atanga, Dr. Tayong, and myself were supposed to take them to his office. A day before they came, there was very serious shooting in and around the regional hospital. And I mean, people had to sleep in the hospital because of the shooting. So it's always assumed that after that shooting, the next day is calm. When we entered his office with his normal jovial self, while he was welcoming these 2 senior staff, shooting started outside, and he didn't even break a beat in his speech, and he kept talking. And one of the ladies was like, "Hey, c'est le coup de feu comme ça." And he said, "Oui, c'est notre quotidien, on va faire comment?" But he was so jovial, and to tell you how serious the matter was, this senior staff actually left Bamenda that same day and stopped her supervision schedule. But in all this, his resilience, his openness has always created a certain atmosphere for collaboration. And I just wanted to bring that testimony to show that that spirit of his, that personality of his, has created a big impact, both in the hospital and in the spirit of collaboration in the hospital. Thank you. Over.
Oh, thank you very much. And any reactions from Dr. Dennis?
Yes, Chair. Thank you very much, Dr. George, for those comments. I think these are things we just, these humanitarian principles, I think we just learn on the field. And actually, just to say healthcare in conflict zone, it's something that you need to continue. Conflicts like this, we don't know for how long it will last. You will not say that you will not come to work. And as I'm telling you, hospitals that have been burnt is because people were brought and there was nobody in the hospital. To be candid with you, once the staffs are there, we actually practice neutrality. I mean, we treat everybody who comes to the hospital. Whether what, we don't need to ask you, who are you, who are you? Now, the gunshot case, you've come to the hospital, we just engage in treatment. And the thing, and I would say, going through this crisis, when I was in Limbe Regional Hospital, there was this crisis, but it wasn't as, I mean, tough as it is in the Northwest. And the experience started from there. And then when we came over here, it was still maybe much tougher, because when I tell you thunderous gunshot, and as time is going on, the city here, it becomes a child's play. Because you just find they can shoot, I can tell you, 1,000 bullets in the city. But I'll call the casualty. Any case, no. Call district hospital in Kwen or PM in Kwen, no. And then you can just imagine, and then you begin to ask yourself, what is going on? The boys are shooting on their side in the air. The military are shooting too in the air. And then in the end, you begin, and I'm happy with this new general that has come. I think we see that many people, culprits have been called, even the forces. Some have been taken, and you know, a lot of things, when they tell you economy of war, I think that is what is going on. And I'm just telling my brothers and sisters that they should know that what is going on now is like an economy of war. And so health workers now, even at the delegation, we have been penalized because they call for meetings only in Buda. Supervisors come from the ministry, they stop in Buda, they stop in Bafusam. Training, the delegate has to carry all the staff from the regions to go. But let me assure you, just respect the days. Mondays, you will not come in. No bus will even come to town. The other days, there is traffic in the town as you will not believe. But avoid tonight, staying in the night in the quarters or going out in the night because it might be risky. There might be, you know, a lot of armed robbers now in the profit because of the crisis, and they kidnap people for ransom. So that is what I would just say. And I know time is up. Maybe some people have other questions.
Yes.
Thank you very much, Mr. Judge.
Okay, so I know Kate Khan's hand was up. Can you unmute yourself if you have questions? Kate?
Thank you. Yes,
Yeah.
thank you so much, Mr. Moderator. And I want to thank Dr. Dennis so much for the great work he's doing at Bamenda Regional Hospital. Not a question, I just wish to express my gratitude to him. I think somebody said Bamenda looks better now, the regional hospital, than it was before then. And I want to think the pictures too are really satisfactory, and also the transparency. I mean, even mentioning money spent publicly like this to also shows a certain great level of transparency too as well. So Dr. Dennis, I was with Dr. Kinge, who's still listening to you, but stepped out for other things. So he also sends his sincere appreciation for the work you are doing. Thank you and God bless you.
Oh, wow.
Thank you very much, Dr. Khan Klingsmeiler. I think I'm pronouncing well. No, Dr. Kinge is really a father, and I keep chatting with him. I know he was here too on the toughest time in Bamenda. And you can see, I showed some of the project, the public toilets that was realized by Dr. Kinge and the team then. And I think when I go to Limbe, I still get some advice from him. It's an elder brother, and I really say kudos to him. He's enjoying his retirement, but still having his clinic and managing his patients. I always seek advice too from him. Thank you very much.
Yeah, without wasting much time, I'm going to call on Professor Joshua Tambe. You can unmute yourself, please. Oh, we cannot hear you. I think your hand was up. Joshua? Oh. We're unable to hear you. So I'm just going to give a minute for Professor Joshua Tambe, if there are any. I think he may have some good contributions and also some insight before we round up the session. And
thank you. Can you hear me?
Yes, we can hear you now.
Thank you very much. It's always a pleasure to be in the town hall, to be able to contribute. And I really want to thank Dr. Dennis Same for everything that he's been doing. I think I have a picture of what is going on. You know, I worked with Dr. Dennis Same when the crisis started in Limbe. We used to send the ambulance through town to carry so many staff and bring to the hospital. So I can only be very, very happy that he's continued with that same spirit to Bamenda Regional Hospital, which is quite a bigger hospital compared to the Regional Hospital Limbe. And as you can see, it's not easy, but one of the things I actually learned from him during that period is that as medical staff in such conflict situations, one key word is neutrality. We don't ask who you are, we don't ask where you're coming from, we don't bother about your political opinions. The most important thing is we have patients that we have to take care of. And once you have that at the back of your mind while taking care of your patients, you don't run into problems with anybody. And it's very, very interesting to be able to see how far he's gone. You know, I've had the opportunities to go to other places, but somehow I felt like the crisis met me in these regions. And you actually see how people are desperate, you see how people are suffering, and you always feel like there is a contribution that you can always bring to these people who are suffering. And I also want to thank those of you in the diaspora. You have been of great assistance. You can imagine working in the crisis and then COVID-19 added to it. But we had a lot of resource persons from the diaspora who gave us advice. We shared cases together. So it's really, really challenging to work in some situations. And as he rightly said, you don't know when the crisis will definitely come to an end. but with neutrality and always seeking to be like a missionary in such settings. I think there's very much to be done. So with the rolling out of the universal health coverage, I just wanted to find out from him how the costs are going to be covered for the first phase in his hospital, because typically universal health coverage is a risk-sharing process. So if it's going to be free, the services that have been selected already to be free, somewhere, somehow, somebody is going to pay for them. So I just want to understand from him, what is the engagement of his facility towards the cost recovery, or is it that the burden of this first phase is going to be entirely on the Ministry of Public Health? Thank you very much.
Yeah, Mr. Moderator, can I?
Yes, please. You have the mic.
Thank you, Mr. Chair, and thank you, Professor Joshua Tambe, a wonderful collaborator, my service head of the Imaging Center in Limbe Regional Hospital. And while here in Bamenda, I continued, I think he has interpreted some of the scans. When we had crisis of no radiologists, he was still there to assist us. Thank you very much, Professor Joshua Tambe. And really, with universal health coverage, how are we going to manage? Because the problem is payments. You can imagine, I think we have more than 400 million, with the regional fund for health promotion, because this first phase, I think the minister knew that this money should not be passed through the treasury. That is a bottleneck if it passes through the treasury. So the 10 regional funds for health promotion, they are the payers. And the regional delegate of public health, who is the regional coordinator with his team, they are like, they are the controllers, and they are the people who will see that what is declared at the district hospital, the health centers, is actually the right thing. So they will make sure that they follow up, do the control, and validate what is coming. And then the minister said on monthly basis, since the money is already at the level of the fund, if the health facilities, the hospitals give their bills at the end of the month, the Dr. Fondo, who is the administrator of the fund, should pay immediately. So we have that money to manage till 31st December. With the exception of hemodialysis sessions, my own bills for hemodialysis, I need to be sent to the ministry. So that payment will be done. And that is what I've not yet had a lot of clarity, because but when we send our bills, hopefully they will look for lines to see how the payments will be done. But for the other one, the HIV-free, which I'm still concerned at the regional hospital, because they're under 5 free consultations, regional hospital is not packed. It's only the district hospital and the health centers. That one, the project has been going on already. It's just like a continuation, because we were in the HIV-free project. Thank you.
Wow, so thank you. And it's been a wonderful time with you here. I don't know if Joshua has any follow-up questions. I don't want to keep everyone waiting, because we love to respect your time. And knowing that today is a national day back home, everyone wants to celebrate, and we want to really appreciate your time for coming here and talking to us. I'm just going to pass the mic over to the moderators who are still here, and see if Dr. Jean-Claude Kate has anything else to add. Just last words, Kate.
Yeah, thank you so much, Mr. Chair. A big thank you to Dr. Denis Same for your presentation and for giving us insight into what's been happening in the Bamenda Regional Hospital. And one thing I also noted in the statistics you presented is that it seems the population is getting poorer, because we could also see the amount, or the huge figures in terms of millions that the hospital is losing because of people unable to pay. But I believe due to your leadership, the hospital is still able to provide care to this huge, huge poor population, probably because of the conflict and because of COVID. So really all I can say is thank you. Thank you to everyone who has participated in the town hall on the National Day, and God bless you.
Yeah, I'm going to pass the mic over to one of our regulars in the town hall, Dr. Tim Fabrice. He's a surgeon and also a lecturer in the University of Bamenda. So just a little word. I saw he put in great work and great show of leadership. So any words, any last words?
Yeah, well, I was not expecting to get the floor today, but unfortunately I could not attend from the start. But I am recently just joined the team of Dr. Same in the regional hospital, given the commitments I took at the university, and I think I am just only full of appreciation for what I could see and just the learning opportunity I gave for me. I've been going to conflict areas since, but I think the regional hospital in Bamenda has a unique way of working, and his capacity to keep all these very highly skilled doctors, very highly skilled surgical team, especially in this hospital, was really, really inspiring for me. And that was one of the things that made me to really feel engaged in this project and to give my own small contribution whenever I can be called up to it. So it's really, really, really a great pleasure to have listened to him. And I really would think that he has something unique that may be useful to teach other areas in Cameroon. Cameroon is a conflict-prone country since the past 10 years. I think there are lots of things that can be learned from the regional hospital and to help to improve the lives of Cameroonians. Thank you.
Yeah, thank you very much, Dr. Tim Fabrice. I would like to get one last words from Dr. Ekiti Martin. I know you've been putting in contributions. I'm looking at those who have been contributing. If you can unmute yourself, just a word before we close the session. Okay, and finally, I'm going to say, I'll give the last words to Dr. Denis Same. If there's anyone else who wants to just unmute themselves, that would be nice. I see there is Mr. Turker. Robin, do you want to say something? Okay, good. So it's been a wonderful time with before Dr. Denis gives his last words, I just want to say it's been a wonderful time. We learned a lot today and saw that I was one of those who said, from the pictures, from the people I spoke to, my mom used to be the general, how do they call it, supervisor of that hospital for many years. She was a nurse. I was born there. I know the hospital that Dr. Same is working in, and I grew up there, both as a child who saw the hospital and who knows the infrastructure. I know 50% of the workers, maybe others have not been retained and others have passed away. And I can tell you the hospital is in a better shape despite being in a crisis zone. And it's very important that we get good leaders who can actually show and emulate an example in Africa that others can follow, the younger generation, and who can actually bring change, even in the midst of despair, and when people are actually in need of someone who can show an example. I always feel that transparency is the antidote of hypocrisy, meaning that just the numbers, I was not expecting to see his financial numbers in this presentation. It shows you how much transparent he go in order to be able to achieve his goals. And we saw that there are several other problems. There are infrastructural problems. There is an issue of mental health, which we do not have time to talk about today. There are issues of gender-based violence. Those are things that actually caught my attention back home. There are also issues of sepsis, which is something which I hold very dearly, and I don't believe people need to die of sepsis at this stage. There's a lot that can be done. And there's gun violence, which is number 2 killer. I also had certain questions. Time is a limiting factor to ask Doctor, in other countries, we see cardiovascular diseases being number 1 or 2. Why don't we see it in this picture? Is it because we are not diagnosing it? Is it because we lack equipment? Is it because we lack the structure in place in order to actually pick up heart attacks and the test and basic EKG machines. Are we able to do that in all the different emergency units? Thank God we are in the phase of creating an ultra-modern emergency, and I hope the diaspora is going to contribute to that. There is also kidnapping. I have friends and their loved ones who are doctors, classmates who were kidnapped in Bamenda. We're all worried. And so this is in a very special session to listen to. And I would just call on Dr. Dennis to say his last words. And two, don't forget, we have 30 minutes. We call it our parking lot, where we are going to be offline, and we'll stop recording and we can chat for a while, get to connect, to know each other before we close the session. So please, Dr. Dennis, you have the floor.
Thank you, Mr. Chair, and thank all the members of our town hall for healthcare professionals. Actually, I had this invitation some weeks back, and I was looking for a time, and I'm very happy that the chairman actually gave me this opportunity. He was to present something on cancer, and we had to push it to June. So thank you for the privilege you gave me. And all the comments, I'm so happy for all the comments, and think that we'll continue that collaboration. Yes, people, I think Dr. Brownhilda have said we'll still get in touch with you, and Dr. Former talking about all this sepsis management. I think with this sepsis, there is a serious issue. I think one of our recommendations was to create, an antibiotic therapy stewardship in the hospital. Because you see, they just that way, they have their protocols. You see, at first you could see a normal vaginal delivery, they're giving antibiotics. You begin to say, what is happening? What are the surgeons doing as concerns antibiotics? Do you give antibiotic chemo prevention, or you're giving actually treatment? There is a serious problem with managing antibiotics in our settings. And I think we want to put a committee on antibiotherapy, because resistance is becoming more and more. It's becoming more of a public health problem as antibiotics are concerned. And when you start seeing sepsis coming and people dying, you should ask ourselves, what is going on? And we think that research too, in our local settings too, should go on. We have been encouraging students, or even what if students could do some studies on that. Let's see what is happening. And also Dr. Gilbert with hepatitis B is the main concern. We'll get in touch with you so that we see how we can still revamp again this committee and see that this public health problem, which is even more severe, more than 10% prevalent already, it's a call for concern that something must be done with this hepatitis B. And of course, the human resource, I'm happy that I'm having applications coming, just that resources may be limited. Doctors are coming, these young doctors who have graduated are putting the applications, they want to work. And I hope that if the means are there, we'll really have to recruit more and make sure we can give them at least what is really reasonable. So, Mr. Chair, I wouldn't be for all.
Yeah. Wow.
All the contributions, all the remarks, we continue to keep in touch. You did something wonderful to think about Town Hall. Thank you.
Wow, thank you very much. And I would want to say a big thank you for your time. I extremely love this presentation. It's one of my best, because it was very, very transparent, and we learned what a leader looks like in Cameroon, what we should be emulating, and the way forward. If all leaders were like this, I think we'll be in a different, we'll be the next Dubai in our country, so we'll be the next big thing. So I think all young healthcare professionals in Cameroon have a mentor that they can lean towards and try to be like you in the future. So we look forward to collaborations, bigger ones, and we also look forward to discussing with other sectors. Our next session is going to be about talking about dialysis in Cameroon, and just talking about how the private sector, NGOs have been able to shape the kidney situation in Cameroon. So we'll give you guys more details. I don't want to let the cat out of the bag. Usually I like to keep things this way, but just know next session you'll be excited. And this session, truly, I wanted to talk about cancers for personal reasons. Maybe because I think also, and I've been talking with Dr. Dennis and others, we may need to also help improve knowledge, especially at the level of our general practitioners, so that we can be able to identify some problems that are existing, but we are not documenting them and we are not diagnosing them. So just a big thank you for those who want to stay for the parking lot is going to be in the next 2 minutes. So see you all there. I'm going to stop recording and also stop sharing on Facebook. And have a wonderful day. Have a blessed day, and happy National Day to all Cameroonians who are here. And see you in 2 weeks. So.